friends or playing, any change in behavior which is persisting for a fairly long period, I would say even a week or two, is something to be noticed. Maybe other people would say even lesser. But I would say if there is something which is really changed and your child seems to be behaving differently for a week or more than that, it does need observation, assessment, or at least being aware of. I'm not saying that you got to immediately take your child to a psychiatrist if 1 week he's not having a bath. You know, I don't know how many of us have a bath every day. Many people don't. So you don't have to necessarily immediately drag the child to a psychiatrist. I mean, I've got a friend who's got a child with Down syndrome. He loves the same shirt. He will not change it. He wants the child. It is not new. That is the way he is. All you can do is to bring different shirts of the same color from the same maker. You know, Louis Philippe red. Okay, buy 5 or 10 Louis Philippe reds and tell him, hey, Louis Philippe red. But he knows the difference. This is another shirt which I wear as today. You know, that kind of thing. But at least some way you can, you know, meddle with his obsession and change, at least get him to change clothes now and then. Now, go back. When we have these changes, which are happening consistently, this child needs evaluation. Why does this child need evaluation? Because if this person is going through a serious mental illness, you know, a major depression or a psychosis, or for that matter even schizophrenia, which is all possible here, a bipolar disorder, these are all not absent in Down syndrome. It's there everywhere. It can happen with anybody. Any one of us can get any of these mental illnesses, don't know. In the same way, our children can also go through such illnesses. And whatever we deserve as an assessment and treatment, our children also need to be done. It needs to be done to the children too. The problem maybe is that children don't communicate so very easily. So we need a lot of patience to observe, watch, see what's happening, take a good idea of the behavioral change. And the key is the change, a persistent change in behavior. Something unusual is happening, and this is persisting. Sometimes it seems funny, sometimes it's interesting, sometimes it even goes into a game. But something is happening which is different from the way my child usually behaves. And this is persisting. We need to assess. In a large percentage, we will see that this change in behavior is because of some other event happening in the house. 7 minutes. 5. Okay. So some change is happening because some other event is happening in the house. Say there is a wedding, and this wedding creates some kind of insecurity in the child because his sister may be leaving the house. That's what he's told. Your sister's going to get married and she's going to leave the house. And he's feeling threatened by this man who's going to whisk his sister away, by this whole family which comes in. And he's angry with his parents for depriving him of the sister whom he loves. So no, these are things which make the child get upset and can show some altered behavior. This needs sitting, talking, explaining, helping. But what I'm talking about, the severe mental illnesses, they need medication. Everybody is afraid to medicate anybody, ourselves for that matter even. You know, if somebody gives you an antibiotic for a urinary infection, oh my God, 10 days. Usually antibiotics are only for 5 days. I will take it for 3 days and then stop. These are things which we all like to do. So we are very afraid to give medication to our children. We wonder what might happen. Side effects is the first thing which comes in. But what we forget is we don't look at the effects. So what's happening right now, what are the deficits we are seeing, and how we can change it by using a medicine. So there is nothing to be afraid of as far as medicines are concerned, but they need to be given an appropriate situations. There are serious mental illnesses where people can come in with a catatonic state. That is, a catatonic state is when the child remains mute, doesn't speak, holds on, just stands in one place with an odd posture, with a hand hanging out like a teapot, and then stands there for a very long period. It has been reported in Down syndrome children. And you might be horrified. The way it improved is by giving electric shock treatment. But the child recovered beautifully and came out and went on to do normal things in life. We are all afraid of these treatments. Important thing is to assess the child, see whether it is relevant, see whether we really need to medicate. Sometimes, apart from all these things happening, there is also a possibility there are other medical comorbid issues. Thyroid functions, a low B12 level, a low serum folic acid levels, all these things. Some kind of serious infection sometimes. And every child who comes in with some kind of a severe behavioral problem needs a proper neurological examination to rule out any other intercurrent or some basic factor, some neurological disturbance which is creating this change. It doesn't mean that everybody, all the children, should be going through a CT scan or an MRI scan or anything. They need to have a proper neurological examination, and judiciously we need to kind of do some testing. Sometimes it could be something like a peculiar form of seizures, epilepsy, which can show us behavioral change. So we need to kind of check for seizures. So a good neurological examination very often tells us what happens. Very rare. I mean, we don't have to do scans for everybody, but if it is warranted, we should. So some few blood tests, a few real serious proper physical examination, evaluation, especially neurological, and then we could start them on appropriate medication. Low dose, wait and see how they react to it, look out for any adverse reactions, side effects, which can all be kind of handled appropriately. Keep following up. And in a number of these cases, you need medications for a very long period. And in some persons, you need it for a lifetime. But all these things have to be assessed appropriately and done in a methodical manner. So one, if there is a behavioral change, do not be afraid. Two, do not try to explain it off by using some idea of your own. Three, if the behavioral change is consistently happening for a period, please get the child observed. If it is disturbing, get the child examined. The sooner you get the child assessed and treated, the recovery is better. The longer you delay the initial assessment and treatment, we call it the duration of untreated illness. The duration of the untreated illness, if it is very long, then the recovery and the response is going to be lesser. So these are few things. Do not be afraid of medication. Of course, some of us from my fraternity are guilty of over-medicating. I'm not denying that. There are some psychiatrists who do not spend enough time to understand, or they say, hey, you know what, look, go on this. And some people start them on a fairly high dose. All that I accept, and it does happen, but that does not need to happen all the time. You work with somebody. If your psychiatrist is not willing to give you time to work with it, you should change the psychiatrist. Do not be rushed. But please do not dump it saying, oh, the doctor did not even see my child properly, did not give me time to talk, did not explain anything. So I'm not going to see a psychiatrist. Maybe you need to see a different psychiatrist. I think you need to kind of wait, assess, do not panic. All these things can be sorted out. It's so disturbing sometimes when we see our children suddenly lost and sometimes crying, sometimes shouting, sometimes, really bizarre, saying, looking at it, hey, what's happening? Why are you doing this? You do something like this. You're afraid that something is happening to my child. No. Do not just collapse there. Wait, get this assessed. It can be treated very well. Let's stop here. Thank you. Somebody's going to tell me how to switch this off.